Hi there. So I'm going to walk into my patient's room and I'm going to be assessing things as I go in. I'm going to be making sure she has on a name badge, that she has her board updated with the right doctor, the right nurses. I'm going to be getting a general assessment of my patient. I'm going to be looking for oxygen. She's not on any oxygen. She doesn't have any feeding tubes, doesn't have any chest tube, doesn't have a catheter. There's no clutter on the floor, any tripping hazards, and the bed's all the way down. There is, the side rails are down, and the call light is within reach. She also doesn't have any IVs started. So I'm going to come in the room, introduce myself. Hi, Miss Matthew. My name is Wyatt. I'm going to be your nurse today. I'm going to provide privacy for the patient, wash my hands, and then I'm going to check her pupils, make sure that they are reactive, round, equal. Then I'm going to look for any jugular vein distension, which we don't see any of that. We're going to get her level of consciousness by asking if she knows her name, what day it is, and where she's at, which she gets all three of those. So next I'm going to ask, can you squeeze my hands? Okay. Can you pull your hands back towards yourself? And can you push against my palms? Alright, strong reaction on all three of those. We're going to check the cap refill, less than 3 seconds. And we're going to check radial pulses, and they're going to be equal, bilateral, and a little rapid. So moving down, we're going to look for any signs of trauma. And we're going to listen to breath sounds. And on the right side, we're going to do a reverse Z pattern. Sink to the right lung. And on the left side, we're going to do a C pattern. And then when we do it on her back, alright. Her lung sounds are clear and her chest rise and fall is equal bilaterally. Her respiratory rate is normal. Deep Kussmaul respirations, actually, with fruity smelling breath. Next, we're going to listen to bowel sounds. Can you tell me the last time you had a bowel movement? Okay, we have bowel sounds in all 4 quadrants. And we'll palpate the abdomen. Soft, non-tender, non-distended. On urination, do you have any frequency or burning sensation? She says that she has a high amount of frequency. Okay, moving down to the lower extremities. Can you feel me touching your feet? Can you wiggle your toes? Can you push against my hands? And pull your toes back towards yourself. Alright, we'll check pedal pulses. They're equal bilateral. And we'll check cap refill, which is less than 3 seconds on each. We would get vital signs on her. And we would also get an IV started to get some fluids on board. So then we would wash our hands and we would leave the patient's room. We would have the bed down, the rails down, and the call light within reach.